I appreciate everybody taking some time to talk about something that is important to almost every single Ohioan across the state. You know, the fact is that the action taken by Governor Kasich and the majority leaders in the Senate and House, it's not working. And the facts are that Ohio is #1 in the nation when it comes to overdose deaths. We have county coroners across the state that are being forced to use refrigerated trucks and trailers and funeral homes to store bodies of overdose victims. And more children are being pushed in the foster care system and have to seek help because their parents are struggling with addiction and sometimes are dying from this drug. And so what we've heard a lot of is the governor talk about the $1 billion that's being spent in dealing with the opioid epidemic. But when you talk to our local agencies, not only in the Mahoning Valley, but across the state, nobody can really figure out where these dollars are going or what $1 billion he's talking about. And so yesterday we saw, or last week we saw the House put forward in their bill an additional $170 million. But the concern is that there's barriers to Medicaid expansion in that bill, and it's like taking money from one pocket and putting it into the other. Today we're here to propose a $200 million investment from the Rainy Day Fund. So we're talking about dealing with 10% of the Rainy Day Fund in order to help deal with addiction on the ground today. And not only are we dealing with the $200 million from the Rainy Day Fund to help fund the programs, but we're dealing with a lot of different issues when it comes to insurance coverage. So I'm going to kind of go through the bill and talk to you about what's in there. So the first $100 million would be dedicated to improve the state's treatment infrastructure. But before we do that, we have to get a collection system in place that is workable for everybody in the state. So within 90 days of the passage of the bill, each county would be required to submit to the Department of Mental Health and Addiction Services a compiled report of the services and programs that are available in that county, then provide the county's current capacity based on those programs and the estimated number of people dealing with addiction that need treatment. The department would also create an online portal that would be updated in real time to show the number of beds and detox centers that were available. So then the first $100 million would go towards increasing the state's treatment capacity for already established programs to expand facilities and increase beds, so that we can treat our people with addiction in our state. Oftentimes I'll go somewhere and people will talk about they couldn't find any beds here in Ohio, so they had to send their loved one to a different state in order to deal with the problem. We need to treat Ohioans here, and with this bill we would have those additional resources in order to deal with the problem. We need to increase the local funding, so that's the next $100 million. We're talking about $100 million going straight from the Rainy Day Fund to the local government fund to fund ADM boards, law enforcement, child protection services, kinship care, first responders, establishing and expanding drug courts. These are all places where people today can be helped if there was just the resources in place. The key piece to that chunk of money that would go to the problem is that it would be up to the locals to spend the money on the things that they need in a particular geographical area. So the problems in Columbus are different than the problems in East Liverpool and Tiffin and Piketon. And so all of these communities need the resources, but the experts on the ground in those particular counties and cities would be able to make the decisions of where they want to spend those resources when it comes to addiction. The next piece after the funding is eliminating the roadblocks with insurance. So this bill would provide a system that would get rid of the prior authorization so that people that need the help and want the help could get the help immediately, because there's so many examples that I've heard where somebody wants the help, they want to move forward, but they can't get authorized for the treatment because of all the roadblocks that they have to overcome when it comes to insurance. So this would eliminate the prior authorization. It would also require that insurance companies cover Vivitrol, cover these other drugs that not all insurance companies are currently covering, so that when these people need these drugs and the providers are ready to provide them, we don't have that additional step of figuring out which insurance company pays for what. So this would get rid of that deterrent, as well as mandate that insurance companies pay for the pills that you can't smoke and crush up and get high, right? So we're talking about making sure that they cover those more expensive versions that are on the market, but many don't cover because of the costs. And so if the insurance companies are going to say then, well, you're making it more expensive for us, how are we going to pay for this? And they say we're going to increase premiums. There is a program embedded in this bill that will cover the difference if there was increases in premiums, which I think is really important so that we don't put this back on the consumer. There's also a piece that talks about educating people. We got to educate our young people about the dangers of opiates and heroin. And just talking about the problem, it doesn't get the job done. So we have to put some resources in schools every day in the classroom in order to make sure that these kids understand the dangers. So that's also a very important piece. We're not going to talk our way or arrest our way out of this problem. And families are being destroyed every single day in almost every community across the state. We need to take action today. And this bill is the step that would be necessary in order to start really wrapping our arms around the problem. I'm going to introduce you to Ruth Bowdish. I'm very impressed with her. She came to my office in Youngstown and told me about all the things that she's seeing on the ground. She's a chemical dependency counselor from on-demand drug testing and work solutions in Youngstown, Ohio. So Ruth,